theanswer.com. Now, from the Signature Bank Studios. Only the biggest stories, only the biggest guests, and only the biggest opinions. This is AM 560, The Answer.
Top of the morning, Dan and Amy. In 2022, employers and private insurers paid hospitals 254% of what Medicare would have paid for the same services, paying reimbursements that are below cost for providers. So who wants to take on Medicare and Medicaid, but especially Medicare, which is sacrosanct? You don't think Medicare denies claims? Of course it does. Medicare doesn't ration. The government doesn't ration. Of course it does. So now that we know that whoever is, quote unquote, in charge rations because of that iron law of economics with respect to scarcity, now we have the conversation about what kind of system should we create such that the rationing is the most transparent and fair and provides the most amount of good to the most amount of people. What we have now, as we have driven everything to be government-centric in healthcare over the last 60 years. For more on this, we're pleased to be joined by C. Stephen Tucker. C.S. Tucker is the principal broker and founder of healthinsurancementors.com. C.S., thanks for joining us. Appreciate it.
Good morning, Dan and Amy.
Your reaction, generally speaking, before we get into some particulars, to all of this scorn that has been heaped on big health insurance providers in the last week, and the conflation of denial of claims with violence.
Yeah, it is interesting that it comes from those who designed this system that are responsible for the elimination of more than 178 health insurance companies since 2010, the elimination of 22 health insurance companies from the state of Illinois, the massive consolidation of more than 1,000 mergers amongst our 5,000 hospitals in this country, the elimination of autonomy of 3 out of 4 doctors who no longer have the ability to own their own practice but must go work for a hospital system in order to get a fraction of the pay they used to earn. It is these people that implemented the ACA, the quote-unquote Affordable Care Act, which we call colloquially as Obamacare. Not one Republican voted for that, and yet it is that law. It is also the IRA, Inflation Reduction Act, passed again by Democrat majorities, which of course cut payments to Medicare Advantage, which is directly resulting in some of the worst Medicare Advantage plans in U.S. history, with star ratings dropping, with out-of-pocket costs increasing. All of these things were implemented by one party, and not one Republican voted for any of it. And yet it is the left who is cheering on the murder of a father who rose from nothing to be a CEO of a major corporation. And they're calling that okay because the company denies claims. Well, who's responsible for the denial of those claims? It is the party that implemented not only the ACA, but also the IRA and all these other government-centric programs that do nothing but squash competition. And every time you inhibit healthy competition, the end result is higher premiums and denial of claims for all Americans.
And worse quality of care.
Yes, of course. You know, it just kills me. I mean, we are now in a situation in the state of Illinois. We were lucky for a long time to have the last man standing, that being Blue Cross Blue Shield of Illinois, who offered a national PPO, meaning that if your health were to decline and you needed to see an oncologist and you wanted to go to MD Anderson in Texas, you could get on a plane without approval, without referrals, walk in the door, and Blue Cross would pay the bill just as if you were in the state of Illinois. That ends on January 1st. So we no longer have a national PPO.
Yeah, why is it ending January 1st?
It's ending because the costs for everything are going up as these massive mergers occur, as doctors lose their autonomy, as cuts are made to all of these programs. This is why it's happening. Every year it gets worse with Obamacare. It never gets better. Rates never go down. New carriers never enter. We keep losing insurance companies. Rates keep going up. And the only way it's even remotely affordable to anyone is that we keep the printing press running and we throw it at insurance companies, and as Democrats and other politicians call themselves heroes for doing so. That's the only way it's even remotely affordable to anybody. My wife and I have the Blue Cross Bronze PPO 701 because it makes no sense to buy anything above that, because all plans, I don't care if it's silver, I don't care if it's a gold, which costs 4 times as much as the bronze plan because deductible is $750. It doesn't matter. Every single plan will subject you to $9,200 in out-of-pocket expense for myself and for my wife. So this is what we're dealing with. Just 10 years ago, I could insure a family of 5 on an HSA qualified plan, which incentivizes them to save their own money in a tax-free account, which they can then withdraw from to pay for a plethora of expenses under IRS Section 502 and write those expenses off at 100%. Those were the good old days. That family would pay $800 a month for the family of 5. They would share an aggregate deductible of $5,000 with 100% coverage afterward, with no printing press needed to print and artificially reduce the cost of that actual health plan. Those days are gone. In fact, 2025, you can't even buy one HSA qualified plan on the health insurance exchanges in Illinois anymore, and in most states anymore. So who's responsible for all that? I can tell you this, it ain't one Republican.
The Holman Jenkins, writing about this in the Wall Street Journal, writes this: understand the system we have today. It takes the 165 million most economically competent Americans, those in prime working years and their families, and gives them a giant regressive tax incentive to overconsume and to be insensitive to trade-offs between cost and benefit. It's done the opposite of what you were just describing was the paradigm 15 years ago, pre-Obamacare.
Yeah, that's very well stated. I mean, the whole system now is set up to simply hide the real cost of health insurance with these massive federal subsidies. People making, couples making $240,000 a year now are getting massive federal health insurance subsidies to artificially reduce the cost of health insurance. And so nobody's really seeing the actual cost. And there is absolutely no one on either side of the political aisle that's doing anything to reduce the cost of health care. They're simply printing money to reduce the cost of premiums. And that is not a solution. And unfortunately, I don't see anything coming down the pipeline from the Republican Party as an alternative solution. I don't see any studies out, no white papers, no nothing, right? Our last chance was in 2017, and we all know we got very close. And, of course, John McCain, with his 2 a.m. thumbs down vote, killed the American Health Care Act, which would have been a wonderful alternative to the ACA. But now you cannot go back to what we had. We have wiped out all state high-risk health insurance pools. Those, if you remember, Dan, and you're one of the few people that remember this, I was insuring people who had terminal cancer long before anyone ever heard of Barack Obama. And that is because of HIPAA law. HIPAA law mandated that every state must manage and partially fund, along with health insurers' profits, a risk pool for those who were denied coverage for pre-existing conditions in the individual marketplace. And over 40 states were following that federal statute, including Illinois. And so I was able to put people on a Blue Cross policy through our Illinois Comprehensive Health Insurance Plan, known as ICHIP, for years before anybody heard of Barack Obama. And I'm talking the individual marketplace, not group. Individual marketplace guarantee issue Blue Cross coverage. When we implemented the ACA, we wiped out all of those risk pools. So now we have a national risk pool, right? The state risk pools are gone. So we can't go back to what we had unless we refund all those state risk pools. It's not going to happen. So then all that's happening is we're looking at a deadline. It's coming up, January 1, 2026, when these massive enhanced subsidies, where a couple making $240,000 can get a massive subsidy, those subsidies are ending on January 1, 2026. There are 23 million people enjoying those subsidies. What's going to happen now that Republicans take control next year? I can tell you already what's going to happen. They're going to pass a continued resolution to continue funding those, because I can't name one federal subsidy that has ever been repealed.
Mm-hmm. So, I mean, and just on that point, because this is so much of how Obamacare was sold to the American public. So we know that keep your health plan and your doctor if you like them. That didn't happen. We know obviously it hasn't become more affordable. We were just detailing that in painful terms.
Right.
People with pre-existing conditions would be protected. Are people with pre-existing conditions more protected now or pre-Obamacare?
Well, they are more protected now due to the ACA. There are some good things about that law, and the ACA basically ensured that no matter what state you are in, you have coverage for pre-existing conditions. However, we didn't need the ACA to do that. There were 10 states that were simply not following existing federal law. They were not funding the risk pools. They were not requiring insurers in those states like Arkansas and Texas and Florida to take a percentage of their profits and fund that risk pool. So those risk pool funds ran dry. And so a very clever politician, Barack Obama, pulled horror stories from those states to sell a massive takeover of the entire American healthcare system. And he did it, again, without one Republican vote.
Have there been any positive effects Obamacare has had on the U.S. healthcare system?
Other than protections for pre-existing conditions, which were not needed by a massive federal takeover of the entire healthcare system. We had a federal law which required that. But other than that, there really has not been, because half the states in America now no longer offer PPO plans for those in the individual marketplace. You can only buy restrictive HMOs. So that includes all the states in the Midwest other than Michigan and Illinois. So if you're in Wisconsin, good luck. And please don't move there if you're under 65. If you're over 65, Medicare is wonderful. You can go anywhere you want practically across the country. But until then, you have a choice of the most restrictive HMOs in the nation in Wisconsin, as is the case with Iowa, with Indiana. Although Indiana residents, if you are listening, there are PPOs available, but you have to buy them off the exchange without a federal subsidy. What a shell game.
Well, so do you think, I mean, since you interact in this space, you have for so long, you know these individuals and how they think. And we talked about this during Obamacare. I remember, too, during the run-up to it and then subsequently to its passage, as I mentioned at the outset, that these insurance company C-suiters have a lot of blame for what has become of the healthcare system because of their rent-seeking. I mean, who do you think wrote Obamacare? Michelle? No, it was all the health insurance lobbyists, right?
Yes. Yes.
So do you think that now these same CEOs, the Brian Thompsons of the world, would like to get back to rational risk pooling rather than serving as, essentially this administrator for this regressive tax loophole that ensures that the insured classes, that provides for the insured classes lavish spending?
Yeah. I not only that do I believe that, but I believe the 174 health insurance companies who used to provide healthy competition, which of course, as you know, Economics 101 drives down the cost of health insurance. I'm sure they would all love to return to a healthy competition level playing field, which is what existed prior to the ACA. But they're gone now. They've all been absorbed by the big companies, United Healthcare, the Blues, Aetna, Cigna. Go on the exchanges. You might find 4 companies offering products now, maybe 5. That's it. They're all gone. So when you eliminate the little guys who offer the competitive pricing, all you're doing is doing everything you can to consolidate hospitals, doctors, insurance companies. It's all a massive merger. And when you do that, you kill competition, and it just results in massive higher prices. And that's exactly what's happened, exactly what I predicted would happen, what you predicted happened, and anybody with a working cerebral cortex knew was going to happen.
So if you're advising Trump or Speaker Johnson or Senate Majority Leader Thune, what do you how do you approach this now massive, complicated, government directed behemoth? How do you try to unwind this in a way that makes healthcare that lives up to sort of the promises of affordability and patient choice and quality?
Well, I would like them to go back and read the American Health Care Act, the one that John McCain killed. And I would like them to pull from there some of the wonderful provisions that are in there. For example, give Americans the chance, once again, to own HSA qualified policies. So they can, once again, fund tax-free health savings accounts. You can't buy an HSA policy on the exchange in 2025. They have killed them all. The only way you can get one now is to buy it off the exchange at full price, which will cost you more than your mortgage payment. This is the end result of what we predicted would happen. There are very simple solutions, but you have to have enough majority in Congress to pass them. And it's very difficult to get that. We have a very narrow margin now in the House of Representatives, by the grace of God, and we'll see what they come up with. But there's a template already there. We were very close to passing it. The Republican Study Committee had it. They passed it through the Senate, and it was one man who killed it. I would go back to that, read that, and implement as much of it as you can, because that was still today the best health care legislation I've ever read.
C. Stephen Tucker is the principal broker and founder of healthinsurancementors.com. I think he was the first man, maybe still the only man in America to have fully read the Obamacare animating legislation. I know you were the first one to do it.
Backwards, yes.
I don't know if anybody has actually gotten through it other than you. I really don't. Anyway, yes.
And if people want to reach you, how can they reach you, C. Stephen Tucker?
Oh, just visit the website, healthinsurancementors.com. Everyone needs a mentor, especially with Obamacare.
There you go. C.S. Tucker, thanks as always. Appreciate it.
Thank you.
Thank you. And he joined us on our turnkey.pro answer line.
This is Chicago's Morning Answer
This is a full-blown 4-alarm holiday emergency here.
on AM 560.
We're going to have the happiest Christmas since Bing Crosby tap danced with Danny Kaye.
The Answer.
This is Sean Thompson here to tell you about our 2024 Food for the Poor campaign. We've partnered with Food for the Poor once again to provide life-saving food for thousands of children and their families in Latin America and the Caribbean. We're talking about a part of the world that continues to suffer from the effects